Friends, bedwetting is a common clinical condition, a medical condition that affects children from the age group of 5, 6 onwards up to 15 years, a time when they are in the prime of growth, a time when their morale should be the best and high. That's a time if they continue to do bedwetting, which is also called in medical terms as enuresis. It needs to be looked into towards a possible attempt of cure. The reason is milestone disorder beyond 5 years, which is not corrected on its own, needs to be corrected by a graduated medical therapy, in which involvement of the doctors and parents is essential and utmost important. Why? Because children who bedwet beyond 6 years not necessarily are bedwetting just because it's another milestone which would get well on its own. Not necessarily in everybody. Many children who are bedwetting at that age group of 6 to 15 may continue to bedwet in their school and college days and even beyond in their adulthood. And that's a very large subset of individuals which we see as urologists in the country. I, Dr. Sanjay Pandey at the Kokilabin Dhirubhai Ambani Hospital, for the last 7 years in the NOCTURIA-BETTING CLINIC in the Department of Urology, have been looking at children who actually come in from that age group of 6 to 15 years. And not them alone. People come at the age of 16, 20, and even 30 years complaining of bedwetting, sudden loss of urine while in deep sleep. It can happen once every day, every week, or even twice at night. And therefore, bedwetting is an important aspect of medical condition, which actually is a menace, which is somewhere where people don't speak up. And it's important for us to speak up on complaints for your doctor to take care of. So if you have a urinary complaint, you would see a urologist. For any complaint that you have, incontinence, overactive bladder, bleeding in urine, burning, urinary infection, and others too. So today on 31st May 2024, we celebrate World Bedwetting Day again this year. And at the Kokilabin Hospital in the Department of Urology, it's an awareness drive that we put forward to one and all. That as parents, it's our responsibility to look at children from the age of 6 to 15 years. Don't continue to do bedwetting. Bedwetting is curable, friends. It has got social connotations. It has got an important aspect in a child's growth, into his morale, into his confidence, into his performance in the school, and the way his confidence builds up and goes down because he gets scolded every day at night, in the morning because he's bedwetting. So bedwetting is curable. It is something which we could probably look into with a renewed effort and vigor. And therefore, once a year, we celebrate this important day called World Bedwetting Day. So if any child in your neighborhood, any child in your family, or any child you know who's bedwetting from the age of 6 to 15 years, and why not beyond that, who has not been treated, who has not been cured, or whose treatment was partial, conditional, and could not get complete relief, it's time to get him the relief. It's time to get him a cure. It's time to give him dry nights and good mornings, that it is a morally very strong and a successful day, week, month, and year from there onwards. So, friends, bedwetting is treatable, bedwetting is curable. Let us parents be understand that there is a behavioral part of the therapy where we look into cutting down our water intake at night. We also need to know that there are medical therapies available today which can bring about a cure completely, compared to twice bedwetting and night bedwetting completely again and again. And as the child grows on, the condition only gets a little better naturally, but does not get cured completely. So why not take a medical help? Why not take a urological help with your urologist in your cities and probably get it sorted out? In Mumbai and in this part of the country, children with bedwetting do come and see us and get completely sorted out. So friends, World Bedwetting Day will come again in next year. But many children will continue to suffer in agony and parents would not know what to do and where to go to. Attempted therapy, partial therapy attempted with the medication which has not given you relief will not help you today. So if we always do what we always did, we'll always get what we always got. It is important to break the ice. Your child should not be bedwetting anymore. It is important that we meet up, discuss the entire relevance of it, identify whether he's 6 years or 14 years or 22 years. Why is he still bedwetting once a week, once a day, or multiple times at night? And this is something which needs to be sorted out. With a lot of passion on this subject, which is a milestone disorder, we've gone to the next level where we look at children should not bedwet and become a situation for late adolescence and beyond when they want to go to college and hostels, or when girls want to get married, they're still bedwetting. It should not happen. We've had examples of that kind in the 7 years that we ran that World Bedwetting Day campaign and looked at the Nocturia Bedwetting Clinic in the Department of Urology. I personally feel very complete when I cure somebody on this disease because it's quite a missed out phenomena. Parents miss out, children continue to live with it. It's all bedwetting multiple times at night, and they are just living a life which is probably progressing. Look at the situation when you get cured. You don't have to look at wearing diapers, wetting up multiple times at night, feeling down, low, and out completely on situations where you should be strong enough, capable, and a performer, uh, future citizen of this country. So, for all children who are between the age of 16, 15 years, who may not listen to this, and it's their parents who happen to be the benchmark of helping out and knowing that this is completely a treatable condition which has been missed out, it is time to wake up to the phenomenon. It's time not to miss out that your child goes to school every day, needs to feel comfortable and probably capable as a winner. He should be rewarded for his dry nights and good mornings. Thank you so much for this Bedwetting Day campaign to be coming to you. Take it forward and let your child not bedwet anymore. The therapy is completely available. It involves a good parental care. It involves a good involvement between the doctor and the patient. And we'll look at it that you continue to do better and better with passing time. So bedwetting or enuresis is a menace which can be treatable and curable. So why wait? Today, 31st May 2024 should be the day you wake up. You're welcome to the Kokilaben Hospital to Department of Urology. At whatever age you are in, if you are bedwetting, we will treat you, we'll cure you, we'll look at you continue to do well. In your cities, wherever you live in, see your pediatrician, see your urologist, see your doctors who deal with the subject and probably take it forward to the highest possible level. Thank you so much.